On the morning of August 30th, 1954, Bernice Eddy noticed that the test monkey, inoculated with Cutter Laboratories' polio vaccine, could not move its legs. She called a colleague over. "What do you think is wrong with these monkeys?" she asked. "They were given polio," the colleague replied. "No," Eddy said, "they were given the vaccine." She told a friend that afternoon, "There's going to be a disaster." By 1952, polio had become the most feared disease in the United States. That year alone, approximately 58,000 Americans, about 1 in every 3,000, had contracted it, and nearly 21,000 developed some degree of paralysis. Iron lungs, metal cylinders that breathed for children whose chest muscles had failed, became a fixture in American hospitals. Jonas Salk had developed a candidate vaccine at the University of Pittsburgh. His method grew all 3 poliovirus strains in monkey kidney tissue, then treated them with formaldehyde, a preparation immunologically active but incapable of causing infection. The method assumed that formaldehyde destroyed poliovirus in a predictable, measurable pattern. And by 1954, a field trial involving 1.8 million children had found it 80 to 90% effective against paralytic polio. The federal government licensed 5 pharmaceutical companies to produce the vaccine for the national rollout: Eli Lilly, Parke-Davis, Wyeth, Pittman Moore, and Cutter Laboratories of Berkeley, California, a family-owned firm founded in 1897 and the smallest of the 5. The body responsible for reviewing each manufacturer's lots before they shipped was the Laboratory of Biologics Control, housed at the National Institutes of Health in Bethesda, Maryland. In 1954, the LBC assigned Bernice Eddy to conduct monkey safety tests on the polio preparations from all 5 companies. Between August and November of that year, Eddy and her team tested 6 Cutter batches on 18 monkeys. 3 of the 6 batches paralyzed the animals. She compiled the data into a report, attached photographs, and brought her findings to William Workman, who headed the Laboratory of Biologics Control. By the time Eddy brought her results to Workman's desk, the LBC was processing safety data from all 5 manufacturers simultaneously, under a timeline the agency had never managed before. The tests from the other 4 manufacturers showed no paralysis in any animal. Eddy's results made her the outlier in a framework the other 4 results had confirmed as safe. Workman invalidated her findings, did not pass them to the licensing committee, and reassigned her to influenza research. The NIH director, separately notified of Eddy's findings, also rejected her report. The LBC continued its review of Cutter's lots, which all passed the required safety tests. On April 12, 1955, the University of Michigan virologist who had monitored the field efficacy trial delivered the results to an audience of 500 scientists and 150 journalists at Rackham Auditorium in Ann Arbor. The broadcast transmitted simultaneously to medical societies and theaters across the country. His trial had spent a year measuring whether the vaccine prevented polio. The LBC's safety review had spent the same year certifying each manufacturer's lots were clean. The vaccine was declared safe, effective, and potent. That evening, boxes marked Polio Vaccine, Rush, left all 5 manufacturing facilities and began moving east and west across the country. Robert Gottsdanker, a psychology professor at the University of California, had succeeded in securing one of the first doses for his 5-year-old daughter, Ann. Approximately 120,000 children received Cutter's vaccine in the first 2 weeks. Cutter's territory covered the Pacific states and the Mountain West, its lots moving from Berkeley to health departments and school vaccination drives across Idaho and California. On April 18th, Susan Pierce, age 7, of Pocatello, Idaho, received the Cutter vaccine. 5 days later, she developed a fever and stiffness in her neck. On the 6th day, her left arm was paralyzed. On the 7th day, she was placed in an iron lung. 9 days after the injection, Susan Pierce died. Her doctor reported the case to the Idaho State Health Officer, and by April 24th, the Communicable Disease Center in Atlanta was accumulating reports from across the western states. Children were developing paralysis in the vaccinated arm or leg. California health officials reported additional cases the following day, with every case traced to Cutter's lots. On April 27th, the Surgeon General telephoned Cutter Laboratories. At 10:38 that morning, a telegram went out from Cutter's Berkeley office to health departments and pharmacies across the American West. Urgent. No further injections of Cutter polio vaccine are to be made. 380,000 doses had already been administered. Unvaccinated family members in vaccinated households were contracting polio. A 33-year-old Idaho mother died after she was infected with polio by her children, who had received the vaccine. When the case count was complete, 113 people who had never been vaccinated had been paralyzed, and 5 of them had died. The Gottsdanker family had been visiting relatives near the Mexican border, and they were driving home to Santa Barbara on the day Ann's head began to hurt. They stopped for ice cream. She threw up in the car. Before the drive was over, Ann Gottsdanker could not move her legs. The Surgeon General suspended the national vaccination program on May 8, 1955, 26 days after it launched. Investigators faced a specific problem. Cutter's lots had passed every required safety test before distribution, and the question was why those tests had not detected what was in the doses. The answer was in the inactivation model itself. Salk's protocol assumed formaldehyde killed poliovirus in a mathematically consistent pattern. Measure the decline in live virus at early time points, extrapolate the kill curve, and continued treatment would reach 0 surviving virus. The assumption held only when every particle was individually exposed to the formaldehyde. When viral particles clump together inside fragments of cellular debris during preparation, the formaldehyde inactivated the outer particles and stopped there. The interior particles were physically shielded. Cutter's preparation process had not adequately cleared that debris before formaldehyde treatment. Their lots contained live poliovirus. The LBC's safety tests were designed to detect live virus, but lacked the sensitivity to find it at the concentrations Cutter's process had left behind. The Surgeon General's Technical Committee attributed the failure to Cutter's manufacturing process. A congressional hearing that June attributed it to the Laboratory of Biologics Control, which had placed excessive trust in a testing framework too insensitive to catch what it was designed to detect. Both findings entered the public record. William Workman was removed as head of the Laboratory of Biologics Control, and the NIH director resigned. In November 1957, the Gottsdanker case went to trial in Alameda County Superior Court, with Melvin Belly representing the family. The jury heard 27 days of testimony, including a 142-page deposition from Jonas Salk, and voted 10-2 that Cutter had not been negligent under the conditions prevailing at the time. They then voted 11-1 to hold Cutter liable regardless, on the basis that a manufacturer who puts a defective product into commerce is responsible for the harm it causes regardless of the care taken in producing it. The jury called the standard extremely harsh and applied it, awarding the Gottsdanker family $131,500. The precedent moved through American courts over the following decades and became the foundation of modern products liability law. By the 1980s, the same doctrine had made vaccine manufacturing so legally hazardous that pharmaceutical companies were abandoning the market. Congress responded with the National Childhood Vaccine Injury Act of 1986, creating a compensation program that shielded manufacturers from strict tort liability and preserved the vaccine supply. The legal framework built around the harm done to Ann Gottsdanker is now the framework that keeps childhood vaccines commercially viable. Bernice Eddy remained at the NIH. In 1960, she found that extracts of the monkey kidney cells used to grow the polio vaccine caused tumors in newborn hamsters, and she concluded the monkeys had carried a contaminating virus into vaccines given to tens of millions of Americans. Her supervisor dismissed the finding. After she presented the results at a scientific conference in New York, NIH blocked her from publishing, stripped her of her lab, and removed her from vaccine research entirely. The virus was eventually isolated by other researchers and named SV40. Whether it harmed any of the tens of millions who received it has never been established. In 1967, the agency that had silenced her twice awarded Bernice Eddy the Superior Service Medal for her contributions to vaccine safety research. 2.5 years after Cutter's lots shipped, Melvin Belly leaned over and asked Ann Gottsdanker to walk as a demonstration for the jury. She was wearing a red sweater that covered her back brace. She turned to her mother and whispered, "Do I have to show them?" That's the report on the Cutter incident. Thanks for watching Cold Wreckage.